Etoricoxib is a non-steroidal anti-inflammatory drug NSAID that is used to relieve pain and reduce inflammation in conditions such as osteoarthritis, rheumatoid arthritis, and acute gouty arthritis. Its pharmacology involves several key aspects. 1. Mechanism of action. Etoricoxib works by inhibiting the enzyme cyclooxygenase 2. COX2 is involved in the production of prostaglandins, which are substances in the body that promote inflammation, pain, and fever. By inhibiting COX2, Etoricoxib reduces the production of prostaglandins, thereby decreasing pain and inflammation. 2. Selectivity. Etoricoxib is a selective COX2 inhibitor, which means it primarily targets COX2 enzymes while sparing COX1 enzymes. COX1 is involved in maintaining normal bodily functions, such as protecting the stomach lining. 3. Pharmacokinetics. Etoricoxib is taken orally and is well absorbed from the gastrointestinal tract. Its peak plasma concentration is reached within 1 to 2 hours after administration. It has a relatively long half-life, which allows for once-daily dosing in most cases. 4. Metabolism. Etoricoxib undergoes extensive metabolism in the liver by the cytochrome P450 enzyme system, primarily CYP3A4 and CYP2C9. Metabolites of etoricoxib are excreted in the urine and feces. 5. Indications. Etoricoxib is prescribed to manage pain and inflammation associated with conditions like osteoarthritis, rheumatoid arthritis, and acute gouty arthritis. It may also be used in other painful inflammatory conditions. Osteoarthritis. The usual recommended dose is 60 mg once daily. Rheumatoid arthritis. The usual recommended dose is 90 mg once daily. Acute gouty arthritis. Etoricoxib is typically prescribed at a higher dose for a limited duration, often 120 mg once daily for up to 8 days. Etoricoxib, like other medications, can cause side effects in some individuals. The most common side effects associated with etoricoxib include 1. Gastrointestinal issues, stomach pain or discomfort, heartburn or indigestion, nausea. 2. Headache. 3. Dizziness. 4. Peripheral edema, swelling of the ankles, feet, or legs due to fluid retention. Less common but more serious side effects associated with etoricoxib can include 1. Cardiovascular events, increased risk of heart attack or stroke, especially in individuals with pre-existing cardiovascular risk factors. 2. Gastrointestinal ulcers or bleeding, though less common than with non-selective NSAIDs. Etoricoxib can still increase the risk of gastrointestinal ulcers or bleeding. 3. Hypersensitivity reactions, allergic reactions, which can include skin rash, itching, swelling, and, rarely, severe allergic reactions. 4. Liver function abnormalities. Elevated liver enzymes or liver function abnormalities have been reported. 5. Renal impairment, impaired kidney function, particularly in patients with pre-existing kidney problems. Etoricoxib can interact with other medications, potentially affecting their effectiveness or increasing the risk of side effects. Here are some common drug interactions to be aware of. 1. Other NSAIDs, non-steroidal anti-inflammatory drugs. Concurrent use of etoricoxib with other NSAIDs, such as ibuprofen or naproxen, can increase the risk of gastrointestinal bleeding and ulcers. It is generally advisable to avoid combining different NSAIDs. 2. Aspirin. Etoricoxib may interact with low-dose aspirin, which is sometimes used for cardiovascular protection. Using both medications together can reduce the cardiovascular benefits of aspirin. If you're on low-dose aspirin, discuss it with your healthcare provider before starting etoricoxib. 3. Anticoagulants, blood thinners. Etoricoxib can potentially increase the risk of bleeding when used with anticoagulant medications, like warfarin. Regular monitoring of blood clotting parameters may be necessary when using these drugs together. For certain blood pressure medications, etoricoxib can affect blood pressure, Combining it with antihypertensive medications may require careful monitoring, as it can reduce the effectiveness of these drugs. 5. Certain diuretics water pills. Etoricoxib can cause fluid retention. When used with diuretics, it may reduce their effectiveness, potentially leading to increased fluid retention. 6. Lithium. Etoricoxib can increase the levels of lithium in the blood, which can be toxic. Monitoring lithium levels and adjusting the dose may be necessary when used together. 7. Cyclosporine. Etoricoxib may increase the levels of cyclosporine in the blood, which could lead to kidney problems. Careful monitoring is required if these drugs are used together. 8. Methotrexate. Concurrent use of etoricoxib and methotrexate can potentially increase the risk of methotrexate toxicity. Your doctor will need to monitor your blood counts and liver function closely if you take both medications. 9. Certain antidepressants. Etoricoxib may interact with selective serotonin reuptake inhibitors SSRIs and serotonin norepinephrine reuptake inhibitors SNRIs, potentially increasing the risk of bleeding. 10. Corticosteroids. Combining etoricoxib with corticosteroids may increase the risk of gastrointestinal ulcers and bleeding.